Benign breast diseases are the commonest presentation in any breast clinic. However, they are not easy to diagnose. Benign breast diseases present with a spectrum of symptoms and clinical presentation. It is very important to differentiate some conditions from malignancy. The breast has a very typical anatomy and physiology, both varying according to various stages in a woman's life. Thus, the breast, which is composed of glandular tissue, supporting tissue and fat, undergoes various changes during the period of adolescence, pregnancy and lactation, and menopause. Patients may present with pain, lumps, enlargement of the breast, enlargement of the axillary part, that is the part of the breast in the underarms. A patient may have a nipple discharge which may be just watery, milky or blood stained. Symptoms are different in pre-adolescent and adolescent age group, in young adults, in pregnancy and lactation, or after menopause. The common benign breast conditions can be grouped into the commonest being lumps in the breast. The commonest type of benign lump is a fibroadenoma, which may present as single or many. A patient may present with pain and thickening of the tissue, which may be because of fibroadenosis or fibrocystic changes. Ducts, the milk ducts, may be enlarged following a spell of breastfeeding, and this usually presents in the perimenopausal age group. A tissue of the breast is also found in the underarms, which is known as the axillary tail of Spence, and sometimes because of hormonal changes, even this tail may undergo enlargement. Infections of the breast are very common depending upon whether a patient is in the lactating stage or later. So this is a classical presentation of a fibroadenoma, which is a very well-defined tumor in the breast which is firm on examination and is totally non-cancerous. Fibroadenomas may increase to large sizes where they may form benign phyllodes tumor. These tumors have a high potential for recurrence and may attain large sizes. Fibroproliferative conditions of the breast include proliferation of different tissues in varying proportions, and they may cause a spectrum of conditions ranging from cysts to dense fibroadenosis. Duct ectasia is a common condition which is found in middle age, and it is because of the milk ducts getting irreversibly enlarged. These may sometimes give rise to infections resulting in cord-like thickening of the ducts and may present with discharge from the nipple. Commonly used drugs in the management of benign breast conditions include vitamin E, oil of evening primrose, low-dose danazol, or even tamoxifen in severe cases. Infections, as we have already discussed, are commonly found during a lactational stage. There may be traumatic fat necrosis following trauma. There may be focal or sectoral mastitis, but the most worrying or concerning form of infection which is becoming rampant these days is granulomatous mastitis. Most of the time the cause is not known, whereas there are various theories of pathogenesis. It is commonest in young women 2 to 3 years after the end of lactation. It is a clinically progressive condition. The organisms may or may not be isolated, making the diagnosis very, very difficult. Treatment may be surgical or non-surgical, but preferably medical management with steroids, antibiotics, sometimes the use of anti-tubercular drugs, immunosuppressants, with or without the use of prolactin suppressing medications. This is a typical presentation of a breast with idiopathic granulomatous mastitis. So to summarize, benign breast conditions are amongst the commonest symptoms in a breast clinic that potentially cause severe anxiety for patients. The commonly occurring conditions are not malignant, are not pre-malignant. Some conditions such as benign phyllodes, tumors, granulomatous mastitis must be properly investigated and differentiated from similar looking malignant disease. Awareness needs to be created regarding benign conditions in order to dispel myths regarding their outcomes. Thank you.